Hi, I'm Katrina.
Hi, my name is Mike.
Hi, I'm Russ.
Hi, my name is Haley.
Hi, my name is Sarah.
Ever since 1996, there has been a law in place to protect your medical records from getting into the hands of the wrong person. This civil rights law is called the Health Insurance Portability and Accountability Act, or HIPAA for short, and was signed by President Bill Clinton. This law, in theory, sounds like a wonderful tool to keep hospitals and doctors from sharing confidential information. While this law has caused positive outcomes, withholding such important information from one's family can bring underlying problems to the surface. Privacy is a basic human right, and the Fourth Amendment is proof of that. Doctors and other public health officials should be able to give every patient the right to privacy. But if a family member or someone close to a person needs to obtain information about them, then problems can arise with either care or care payment for that individual. Safety is the number one priority for parents when it comes to their children. This law allows for teens from the ages 12 to 18 privacy for their medical records. Even if a parent wanted to gain access of their child's health records, then they would need a written HIPAA agreement form. This law is something that many teens, especially those who use birth control without their parents' knowledge, rely on to keep their medical transactions confidential. While it is great teens have access to this medication that they normally wouldn't because their parents' views, it can be a danger. If a teen is using birth control and has medical problems from the contraceptive, it could cause some roadblocks or difficulty in order to finding out what is wrong with the teen. Another example of the danger that arises from parents not knowing what is happening medically with their children can be seen in this case study. This case study involves a 17-year-old girl who is away at college and is dealing with depression, anxiety, and an eating disorder. If HIPAA did not exist or was not as broad, then the parents of this girl could have been alerted, and this individual wouldn't have had to struggle alone for so long. This law covers treatment, payment, and healthcare operations that are included in people's medical records. The confidentiality of HIPAA can keep some from successfully handling his or her affairs. Because this law exists, some transactions involving payment and treatment can become more complicated. Specifically, HIPAA should be able to ensure that people who seek treatment at an agency or office shouldn't worry about the office telling other patients, professional acquaintances, personal acquaintances, and friends about a person's treatment. While this should be guaranteed under HIPAA's broad coverage, this law can cause a slowdown of payment or services that are being offered and administered to a patient. If the necessary documentation for a person to release information isn't complete, then patients cannot continue forward with their treatment and diagnosis. This law also creates tension between patients and doctors, which can strain how the pair work together to keep the patient healthy. Since this law is being enforced, family members are going to visit loved ones at hospitals and are being turned away because nurses fear they'll be revealing too much information about the patient. Since this law exists, it can also make a patient trust a doctor less, since they will feel peculiar about the doctor being mandated to keep things confidential. This can cause them to not be as willing to share what's going on with the doctor. This law also increases the use of lawyers in medical practice. Since there are so many ways that someone could break this law and infringe on someone's rights, there is a never-ending flow of lawsuits for HIPAA. According to the American Hospital Association, it is expected that HIPAA compliances will cost providers $22.5 billion over the next 5 years. Recap. As a U.S. citizen seeking medical treatment in the United States, HIPAA ensures that your medical treatments are kept confidential at some unsettling costs. If HIPAA were to be revised, then the medical treatment in the United States would greatly improve. HIPAA may save people from embarrassment, but people's safety, relationships, and paychecks should not be taken as casualties.